Monday, March 24th, 2025 will be 43 years since World Tuberculosis Day was first observed. This also marks 143 years since the discovery of the bacteria that causes tuberculosis, more commonly known as TB. The theme for 2025 is We Can End TB. Commit, invest, deliver. Globally in 2023, 1.25 million persons died as a result of TB, and 161,000 of those deaths were persons also infected with HIV. It was also estimated that there were 10.8 million persons who fell ill with TB. Saint Lucia recorded one death as a result of pulmonary TB in 2023 out of 2 documented cases. There were 0 documented cases of HIV-TB co-infections. If Saint Lucia is to end TB by 2030, we must have a sustained commitment to doing so. This requires continued financial investment, as well as the effective delivery of interventions that are critical to TB prevention, diagnosis, treatment, and care. We all must own our responsibilities to ensure the end of TB in Saint Lucia. By the World Health Organization standards, Saint Lucia has a low burden incidence of TB. There are less than 10 documented cases of TB for every 100,000 persons in the population annually. If any one of us is diagnosed with pulmonary TB, we can spread it to persons we live, work, and play with through coughing, speaking, and singing. Taking the recommended TB medications as prescribed for at least 6 months will cure TB. If you have been identified as a contact of someone who has been diagnosed with TB, and a public healthcare worker gets in touch with you about getting screened and tested for TB, please follow their advice, especially if the following may describe you. You are having a cough for more than 2 weeks that is lingering and not improving. You are a chronic smoker. Smoking damages your lung tissue, causing you to be at a higher risk for developing pulmonary TB. Your immune system is not functioning adequately and is compromised by chronic diseases such as diabetes, lupus, and HIV. As someone who has been identified as a contact of a pulmonary TB patient and requires further screening, you may not be infected with TB, you may develop latent TB, or you may develop pulmonary TB. The only way to know if you have any form of TB or not is to get screened through being assessed by a doctor, getting the necessary tests done, and following the advice given after those tests are completed. All screening, testing, and treatment for TB is covered by the state, and thus will not be at a cost to you, the patient. While pulmonary TB can be spread through coughing, speaking, and singing, latent TB cannot be spread. Latent TB is a dormant form of TB, meaning it is present, but think of it like it is asleep. If one is diagnosed with latent TB, it can be cured and significantly reduces the risk of that person developing pulmonary TB later in life, likely when their immune system may become depressed or compromised. The BCG vaccine is a form of immunization given to infants to protect them from developing meningitis due to TB, as well as disseminated TB, meaning TB that spreads to major organs in the body, including the lungs. Please ensure that your infant receives the BCG vaccine as scheduled, unless otherwise advised by your medical practitioner. Tuberculosis is curable. If you have been diagnosed with pulmonary TB, take the treatment. If you do not do so, pulmonary TB will kill you. Latent TB is also curable. While treatment is at least 3 months, getting treated reduces your risk of developing pulmonary TB later in life. TB is real and still exists. In commemorating World TB Day 2025, the Ministry of Health, Wellness, and Elderly Affairs commits to the effective delivery of interventions critical to TB prevention, diagnosis, treatment, and care, and the government of Saint Lucia commits to continued financial investment in TB. Let us all, as individual persons, commit to getting tested for TB when advised to do so, as well as taking the treatment prescribed to cure TB. Together, This will ensure the elimination and end of TB in Saint Lucia.